All right, everybody, here we go. I'm going to try to do this in one shot, and we got the wide angle going. One, we might pick up a little Dr. Axel here in the passenger seat. And two, I want to post this on YouTube, sort of like an updated version of a informative podcast, or just in general, something that I haven't really spoke to any of my subscribers or viewers in a while. I feel I'm something like super updated. So it's 2022, we're early February here, and I'm about to go back into work for an afternoon shift. And there's just something I just got to address. I want to bring this up now because the more I practice, the more my clinic is going. And really, thank you to YouTube, because YouTube has given me this platform to be able to advertise and showcase what it is I do, and made it a lot easier for me to grow my practice in the current, state that we're in. So, how often should I go to a chiropractor? I've made short videos like this before, but I think it's very important for a chiropractor such as myself. I think it's very important that I make these videos so that when you're researching what a chiropractor can do for me, what a chiropractor can do for you, what a chiropractor can do for your kids, how can chiropractic help my lumbar disc, how can chiropractic help all these other things, we have to get a realistic expectation of what it is that chiropractors not only do, because I'm not even going to address that right here. I'm going to address how often would you need to go to a chiropractor, and why there's such a variation, this spectrum of how often people need to be in to see their doctor, because the reality is we're all so unique and different in the injuries and or dysfunctions that we're suffering from. And I think all too often in chiropractic, there's this terrible stigma attached to you're going to have to go all the time. Now, here's the thing. Yes, chiropractic is a lifestyle in the sense that you are using it as your primary means to get out of pain, to function better, to have a better quality of life. You're not relying on going to the other primary care physician to potentially get this big workup or panel done on, potential new blood work, or potential, check all the boxes, and then maybe you get a medicine, maybe you don't. Maybe they tell you to put yourself in a situation where you'll have less anxiety. Maybe they'll tell you to, take it easy for a while. Maybe they'll tell you to exercise more and eat less, whatever the case might be. Chiropractic is like that portal of entry provider that you can do something very quickly to stimulate the body, tap into the nervous system through the spinal column, taking pressure off nerves, and actually making a very distinctive, fast change. Now, how beneficial that is in terms of I shouldn't say beneficial. How about this? There's no one-size-fits-all model when it comes to chiropractic care. Just like we talk about in society, it's not a one-size-fits-all for everyone when it comes to the protocol with the virus, right? Well, I don't think that chiropractic is for everybody. Truly. I think that there are other modalities that best suit other people. And I think that chiropractic is very necessary for a great portion of the population, especially those that actually feel pain. Meaning their back hurts, their neck hurts, their arm hurts, their shoulder hurts. So if that's somebody out there, then they need manual therapy, and I think the most impactful thing they can do for that is a chiropractic adjustment. I've made that clear on so many videos. The thing is, when your 50-year-old dad, just an example, or if you're a 50-year-old dad and you come into me and say, how can we fix this? I might tell you I need you to come in every other day for the next 2 weeks, and we're going to work in this combination or pattern of adjustments. This is just an example. And we're going to do a little soft tissue, and we're going to do some range of motion exercises, and then I'm going to release you out into the wild and come back to me, when you feel a little sore, or I'm going to talk to them about intuition and listening to their body, and come back to me for some adjustments. An example. I don't do my reported findings out there like that, doctors, so don't you go trying to school me here. But what if 35-year-old Brad, I don't know, made up another name, comes into me and he says, I've had the same pain here in my lower right part of my back at work, and the same pain in the right side of my neck at work for like the last 6 months. It's driving me crazy. I feel it all day, every single day. And I say, hey, look, let's go ahead and get these x-rays. Let's do a real good Gonstead, careful analysis like we would do for the grandpa too. My point is, let's go ahead and work in this pattern and work in this joint. I think this one joint that's really swollen is a big part of the problem. And we go over his x-ray and say, like, your spine is pretty much, there's nothing that's indicative of degeneration, no wear and tear. The discs look healthy for the most part. The neck doesn't look like it's severely, reverse curve. And I think in 2 or 3 adjustments, you're going to feel tremendously better. Like within the next 2 weeks, like I think you're going to not even feel this pain anymore. And I'm willing to bet if you do these little different exercises or this stretch and use this lacrosse ball or foam roller to do these little exercises or soft tissue habits, form these soft tissue habits, you're going to be near 100%. And then that happens. Well, that person should still come in to get their spine checked every once in a while, especially if they're feeling a little fatigued, a little run down, maybe a headache, maybe they're starting to feel a little bit of that old pattern kind of creep back in. But I can't tell you how many times I've seen, and you can look at some reviews or just, whatever, ask around. Like, I really try to be as humble as possible. But where I'm going with this is I can't tell you how many times I've seen people in their 20s, 30s, 40s, they come in for a couple of adjustments. And, when we're hitting the home run adjustments, the ones that I feel are setting exactly the way I want, where we're taking into consideration the lateral wedging and the rotation of the vertebra, the joint that's in question, we want to take we want to take the stretched fascia out and the compressed fascia and stretch out, right? We want to compress what needs compressing and stretch what needs stretching. And that's not a muscle I'm talking about. I'm actually talking about the disc fibers in the spine and the fascial distortions that exist within these, misalignments, if you will, okay? And when you start specifically adjusting like that, you are going to see the greatest result for your patient. Now, I'm not really just talking to you doctors out there because, I'm not going to tell any of you, what to do. Certainly students, this is my input. And certainly people out there seeking chiropractic care, this is what I find gets the best result, the greatest amount of the time. Is compress what needs compressing, stretch what needs stretching, be very conscientious of the damage done to the disc, because if I just flipped you on both sides and did your lower back, and I just took you, face up and rotated your neck around a few times, then that's pretty much a lot of the stuff you see on social media. That's a shame, because I don't feel that's what chiropractic's best representation is. Yes, do we like big, cavitating, awesome sounding adjustments? Do they feel great? Absolutely. I love it when my bones go boom-a-da-boom, boom, boom, too, okay? But in all honesty, that's not the measure of a great adjustment. The measure of a great adjustment is the chiropractor being honest with himself and you as the patient, okay? Or you as the chiropractor being honest with somebody like me as the patient, saying like, that's the quality of movement we were looking for. That's the quality of cavitation, so to speak, the quality of crack, if you will, that thudding, pressure gradient change at the level of the disc or at the joint, how those ligaments are affected in the actual chiropractic adjustment, because that's how the neurology registers what happened. That's how the body's able to heal. Because I can tell you right now, you take stretched fibers and stretch them even more, oh man, that's a bad day. You might feel better for 20 minutes if you're lucky, but that's coming right back. But now I went all into like how the chiropractic adjustment works to like make this amazing, the best possible impact, so you can heal and have like the longest amount of healing at that joint before potentially having to either get another adjustment or adjust a different bone or go into your exercise active routine rather than like doing the passive therapy with a chiropractor or the therapist if you're choosing. And that's how you get stronger and become stable. But just remember, if you are somebody that comes in, like example number 1, we talked about the 50-year-old dad, or we'll just go ahead and now say like the 70-year-old grandpa or grandma, okay? It doesn't matter, guys. When they come in and they have bone-on-bone degeneration because they had an unfortunate injury that kept, degenerating, or they've never been to a chiropractor or never gotten the care they needed over whatever amount of time, and their L4, L5 lumbar discs are completely squished and there's nothing left there, and their hip tendonitis is so bad because they've never addressed anything, do you think that this person is going to be better in 2 or 3 adjustments? Do you think your teeth get cleaned if you don't go to the dentist and check them every 6 months or whatever the rate is? If your if you're going to the gym, do you think you're going to get buff and lean and strong in like a gym session? No. It's the same principle. So if that spine that we should be taking an x-ray of almost all the time, of course there's always the exceptions, guys, come on. Almost all the time when you look at those x-rays, we are going to get a great amount of information, like the most amount of information we can on the bone quality, the misalignments of the joints, we'll be able to ascertain the quality of 99% of the disc issues, but based on the way the joint is sitting. And we're going to be able to see if there's a reason why we need to do advanced imaging, or why there's a reason why we should or should not be taking somebody who maybe have a harder time getting out of pain, like to actually admit them, to begin a trial of care. So yes, it's really that detailed. It's really that important. You know, it varies so much. And look, there could be a young soccer player, 15-year-old soccer player out there as an example too. They might need frequent care depending on the type of sprain or strain injury they had. Is there a compression fracture based on like a head-on collision for a football player? These things, they don't get better overnight without actually getting in there and doing like a passive range of motion, extension or flexion biased therapy, chiropractic adjustment, and actually start triggering that nervous system or stimulating that nervous system to be able to adjust to, forgive the pun, what's been going on. I'm looking at the camera. I've been going on for 11 minutes and change. Guys, I really hope that this video brought some informative elements and something that was providing, the education and insight that maybe you were looking for when it comes to what's the reality, of going to the chiropractor all the time versus how often this one goes versus how often I want to go. Expectations of getting out of pain or having, functions. And again, sliding in another one right here at the very end, vertigo. I can't tell you how many times, especially in the last 2 years, you know what I'm talking about. In the last 2 years, vertigo cases through the roof. Maybe like between 35 to 50, patients experiencing vertigo, and just in the last 2 years alone that walked into my office, chief complaint, vertigo. And we can resolve about 85% of the cases with like 1 or 2 adjustments. Again, it's all about being specific and tricking the neurology, stimulating, working on the balance. Remember, brain and spinal cord, guys, all connected. And then there's just other ones that, even when you're doing the Epley's maneuver or doing very sophisticated exercises, we see, sometimes that other 15% of the time, it's like, we're referring to a specialist or, just time. Sometimes time is what it takes to heal. There's all this variation. But there it is. That's my open and honest talk and my updated version of, going to the chiropractor, expectations versus reality, and what to expect, and, what does your spine look like, and timetables, and I just want to get out there and speak from the heart, so I'm not editing this. So 13 minutes and some change in, guys. If you ever need anything, please reach out, comment. You know where to find me. Everything's in the description. If y'all need anything, till next time, it's Dr. Pearlman.